Isn't that like old people stuff? Prednisone side effects can make you feel old, and that is miserable. Today, we're going to talk about how prednisone side effects are basically making you old before you should be. I know when I was on prednisone, I felt that in my 30-something body that I was suddenly a 70-year-old, or maybe just 50, but still, I was too old too soon. So we'll talk about what it feels like being on prednisone, and then we'll talk about the guidelines for what we should do to prevent consequences, and finally, how we can get calcium. So, this is a picture of me with no filter, no makeup, while I was healing and taking prednisone. I'd been in the hospital the day before, all day, and this is me with hot flashes. You can see my cheeks and my chin are all pink. They're all reddish from hot flashes and red flushing. I not only had colors changing on my body, but I also felt hot. It was the stereotypical woman going through menopause who said, "Is it hot in here or is it just me?" That's how I felt. And I shouldn't feel that way, at least for another 10, 15, 20 years. So that is one consequence of prednisone, is you can get flushing. You can also have mood dysregulation, like you see greeting cards talking about women going through menopause and how her mood is unpredictable and how she has mood swings and she's on a roller coaster. Those same things happen while you're on prednisone. The eyes. So somebody in the Facebook support group this week had a question about eyes, and what they were wondering if what they were experiencing was normal. And I want to assure you that it is normal to have your vision feel different while you're on prednisone. You can have blurry vision. So I just remember waking up, putting on my glasses, looking out the window and thinking, I can't see as clearly as I should with my new prescription. Why is that? And then a few hours later, it would clear up. And it's because of the prednisone, that blurry vision. Next is glaucoma. Now, glaucoma is when there's too much pressure in your eyeball. It's like when you turn on a hose and you have a kink in the hose and it's just building up behind it, and like on a cartoon, it'll just explode. Well, your eyeball doesn't explode, but there is damage that can happen. And there's the nerve at the back of your eye that can be compressed and it can cause blindness. That's pretty rare, but it can happen. And so for all of these reasons, everybody who's on prednisone long term should have an eye exam at least once a year. The next one is cataracts, and this is a special kind of cataracts. It's called posterior subcapsular cataract. So basically, it's different than the kind that happens in typical aging. Like my grandma, she had these beautiful blue eyes that kind of looked a little bit cloudy. That's not what this is. This is different, and it can also lead to blindness. But what's the good news about cataracts is you can have cataract surgery to fix this. And you can also take medicine to help with the glaucoma. So these are preventable things as long as you're aware to look out for it. So if you're ever having any issues with your vision, be sure to get it checked. Next is diabetes. And we have talked about this in depth in many other videos. So be sure to check out the prednisone weight gain series if you haven't already watched that. But basically, prednisone causes hunger cravings and high blood sugar, which can lead to weight gain and diabetes. There's a 4 times greater risk of getting diabetes while taking prednisone than if you don't take prednisone. And the number one thing you can do is to eat good food for you and avoid refined food, especially refined carbohydrates. Next is heart. So you have a 4 times greater risk of heart disease while on prednisone and an increased risk of high cholesterol because prednisone looks like cholesterol. The shape of cholesterol and the molecular shape of prednisone are really similar. And so prednisone interferes with that cascade of hormones that come from cholesterol. And so it can lead to high cholesterol. And all of this can lead to heart disease, such as heart attacks and strokes and arrhythmias and even sudden cardiac death. There's a 2.56 greater risk of heart disease while on prednisone. Next is osteoporosis. And I covered this in more depth in a past episode called The Silent Side Effect of Osteoporosis. So if you want to know more about it, check that episode out. And basically, if you're taking prednisone above the normal physiologic dose of cortisol in your body, which is 7.5 milligrams or more more than 3 months, then you have a greater risk of osteoporosis. And the worst side effect, in my opinion, osteonecrosis or avascular necrosis, which is where in this x-ray you can see somebody had to have their joint replaced because the prednisone led to basically joint death, like the bone died in the hip. So it's important that if you're having any hip pain, that you report that to your doctor and that we follow the recommendations of the rheumatologists, who are the doctors who prescribe prednisone the most. And they say that lifestyle modifications are important to prevent osteoporosis. And this is straight from their guideline. And it says to do weight-bearing exercise and resistance training. So doing things that have impact on your bones. Eating a balanced diet, especially one that is high in calcium and potassium and all of those good nutrients. And maintaining weight in the recommended range, which is pretty tough while you're on prednisone, but it's doable. You can do it. And then finally, not drinking alcohol and quitting smoking. Those can both lead to increased risk of osteoporosis. Finally, they say to take calcium and vitamin D. And if you want more suggestions of ways to get calcium and vitamin D, check out that video, The Silent Side Effect of Prednisone, which is osteoporosis. And there's a whole lot of examples of different types of calcium that you can try. I was taking prednisone for a really long time, and I knew that I needed to take calcium, but I didn't know the best way to get it. I didn't know how much I really needed, and I didn't know what else prednisone was doing to me on a nutrient basis. I knew as a pharmacist that it had to be doing lots of bad things, but I didn't know precisely what those were because no one has ever definitively defined what those problems were until I did. And I looked at all the literature and I figured out that prednisone is stealing 10 different nutrients. There's no list out there published by anyone to give us a great details about this. I had to look all over to find all of the information so that I could create this dietary supplement. It's called Nutrinize Zone, and it is designed specifically for people on prednisone. It has those 10 nutrients that you need that prednisone is stealing, and it's the only supplement you need while you're on prednisone. It is formulated so that you can reduce your suffering, replenish your body, and recover from prednisone. It's on sale at nutrinize.com, And if you watch this before May 31st of 2019, you can use the discount code LIVE, as in we are live right now on Facebook, and it'll give you 15% off at checkout. So I hope you take me up on that offer and find that recovery and reduction in your suffering. I created it for you because I wish someone had created it for me while I was on prednisone. I'll talk to you next week, going live on Facebook, the Prednisone Pharmacist page.